Cord blood banking. I don't talk about the pros and cons of cord blood banking, but you will need to cord blood banking. I don't talk about the pros and cons of cord blood banking. You're welcome to look it up online. You will need to tell the hospital way beforehand if you decide to do this or choose this method. There's private cord blood bank and there's also public ones. You can choose to donate them as well. So basically, the parents pay for a private bank to store the baby's cord blood so that they have access to the stem cell in case of need. Doctors actually do not recommend that you do it because of the slight chance that your baby will need stem cells someday. But if you know that there's a genetic problem that runs in your family, some people do consider this. If you decide to do it, I have one tip for you. It's best to save the cord blood banking to your last child, because stored cord blood can be used among siblings. And these stem cells can be used to treat blood diseases such as leukemia. The maximum freeze time is around 18 to 20 years. In this part here, we'll talk about birth plan. Birth plan is a brief and single-page idea of your labor, and it's a really great, easy communication tool. So just to let the people around you, the care provider, know what you expect. So be short and concise, only have the main points. And this is the exciting part about giving birth. You can make a plan, but then remember, nothing is going to go according to plan. In life, we make a lot of plans, but have expectations that unexpected are going to happen. Also have a lot of flexibilities. Why do you even need to learn about birth plans? Just so that you won't be surprised by it. There are a lot of things that aren't specifically taught. Like, I never knew that I had to deliver my placenta after delivering my baby. And there are small things like who's gonna cut my baby's umbilical cord. This is an example of a birth plan. It's very simple. It's only one page. You have your name on the top and your supporter's name. So your spouse name or your partner's name, location, home, hospital, and the care provider's names. It's actually a very good keepsake if you like to keep things and keep a book for your baby's birth. The baby's gender if known, and the baby's name if you already decided, so you can let the doctors know this is what I'm going to name the baby. In this part here, I'm going to do one recap on when to head to the hospital. When do you call triage? When your contractions have a regular pattern. They're 5 minutes apart, and that one squeeze just tighten up and hold it for almost a minute. That's when you can call your hospital or triage or your midwife. Or if your contraction it's only 2 minutes apart and it doesn't last for a minute, but it still becomes a pattern, call the triage as well. Another reason for calling the triage is that the intensity of the contractions gets so big. But you can't find a pattern, you can still call. So the birthing options including vaginal birth, water birth, and C-sections. C-sections is not by choice, and to be honest with you, water birth is not recommended by TCM, and I can explain to you why that is in a little bit. Okay, you can start preparing for yourself. What are you going to bring there, and what are the clothes that you plan to wear? I need to make a big notes here. Before COVID-19 happens, you're actually allowed to wear anything you want, any kind of clothing that you're comfortable in. I do not know about the details at this point. There are many things you will have to speak to your doctor or call the hospital to ask. So there are other things such like the environment. Would you like to have your favorite music on? Would you like to have a really quiet room so that people don't come in and out? You can put these things on your birth plan and let the nurses know when you go into your delivery room. I like to have a quiet room so that people don't come in and out. Would you like to use essential oils or aromatic scents? And how would you like the lighting when you give birth? Do you like to keep the lights off and then have a little bit of lights from the outside if it's nighttime? Do you just want a night light? You can choose to move around if you like. If you're on epidural, you're mostly on the bed, but you can still move around lightly. I put this in because I do not know when COVID-19 is going to end, but normally they allow another person to come in, a photographer, to take pictures for you. And even your spouse or partner can take the pictures for you too. Pain management preferences: epidural, sterile water injections, morphine. The later two ones are used by midwives, so epidurals is the more regular choice in Ontario. Interventions: IV fetal monitoring. Would you like them? You don't have to, but the hospital usually put it on. If you choose water birth, you can ask if the hospital has an underwater fetal monitor. It's actually an option. Or you like to put down no induction unless necessary. And you can put something like assisting birth, no vacuum assisting, or you don't want any cuttings at all. If your baby is too big or your labor is not progressing, they might suggest cutting. Okay, and this next one here, break your water. What it means is we break our water probably before we get in the hospital, but sometimes it breaks, but it doesn't break fully. A lot of times the doctors actually have to break the water open for you. So it's already leaking. It breaks a little bit. It doesn't mean that it's always completely open. So there's a chance that they might have to break your water for you. And you can also ask some favors from your doctors and nurses, like I said before. Ask them to help you on breathing and let you know when to push and when not to push, and avoid laceration. And that's a big note. Please let your doctor know I'd like to avoid laceration. I can't stress this anymore. We don't want any assumptions. So please talk to them about it. It will make your postpartum so much easier if you can minimize the tearing, if you can not have any tearing at all. The tearing, the pain, may last for 2 weeks. After the delivery, umbilical cord. Who's cutting the umbilical cord? Would you like to choose delay cutting umbilical cord? Studies have shown that delaying the umbilical cord cutting by a few minutes actually help the baby because it actually let the blood to get inside the baby and let it rest before they cut it. Delaying the clamping of the cord allows the blood to transfer from the placenta to the infant. Sometimes it can increase the infant's blood volume by up to a third. The iron in the blood increases infant's iron storage, and the iron is essential for a baby's healthy brain development. So this is a very common method in recent days. Placenta. Some people keep the placenta for memory's sake or use it for encapsulated pill. Or the next one that I just talked about slightly earlier, the cord blood banking part. Would you like to bank them? Would you like to donate them? After delivery, you can request that I want to see the baby right away. So you want to kangaroo the baby right away because usually after the baby comes out, they do clean the baby right away. So there are 2 newborns medications that they give to baby almost immediately after birth is the injection of vitamin K. It helps to prevent bleeding. And in Ontario, all babies currently receive antibiotic eye ointment in each eye after birth. That is the jaundice screening test, hearing test, and newborn screening test. And you're also required to register your baby's name within a month. They will give you a temporary health card slip before you discharge. After delivery, I have a note for the partners or spouse. After delivery, take care of your wife or partner and try to give more attention on your wife or partner, not on the baby. I know that you're first time daddy, you're very excited, but she really needs you. In this little section here, I'm going to talk about why water birth is not recommended in TCM. It's actually introducing dampness and coldness into your body when your body is at the weakest state, having the biggest exercise, doing the biggest thing in your life, and you submerge yourself into the water. Yes, it's good for pain, but it's actually not good for your body. Let me try to explain it this way. When you're giving birth, you're exercising. So our body is moving, everything is heated. So let's put your body in a heat mode. Okay, and then water, dampness, the cooling. So the cold mode. Our body is actually not designed to have such great insulation between the hot and the cold. So it's not the best to put your body in two extremes. Not the best thing to put yourself in an environment where your body is at the weakest and you don't have the energy to actually protect yourself from cold and hot at the same time. Your body insulation, your body homeostasis is not actually equipped to do that much work. So in TCM, that's a no-no, big no-no. But if my patient decides to do it, I offer my knowledge, knowing the doula's way of doing things and explain things from the TCM perspective, and my patients or clients are welcome to choose whichever method they like to. I'm still going to assist, try my best to help them in their postpartum recovery.